years ago yesterday, the World Health Organization declared the novel coronavirus outbreak a global pandemic. According to the CDC, more than 1 million people in the U.S. have died from COVID 19, and millions more have been hospitalized. So, what have we learned about the virus 4 years later? Joining me now in Studio 57 is Dr. Amesh Adalja. He is a senior scholar at the Johns Hopkins University Center for Health Security and an infectious disease expert. Thank you so much for joining us. So, you remember 4 years ago, there was all this mystery surrounding COVID 19. A lot of research has happened since then. What do we know for sure about the virus now?
Well, we know what it is. We know what type of virus it is. We know how it infects people. We know incubation periods. We know signs and symptoms. We know complications. We know how to treat it. We know how to prevent it. So if you think about 4 years in a novel virus that had not been known to humankind, that amount of scientific data is really unprecedented, especially when you couple it to the fact that we have safe and effective vaccines that hit people's arms less than a year after the virus was discovered.
And what remains a mystery about COVID 19?
We still don't understand how it first jumped into humans. We know it originates in bats. We don't know what that intermediate animal was. There's also all of those swirling rumors about the lab leak in the Wuhan Institute of Virology. We don't know that. We don't know why certain people get long COVID and certain people don't get long COVID. We don't know why some people have been impervious to infection. There seems to be these people who've never gotten it before. That's also something that's interesting. So there are still important things that we need to learn, and there's going to continue to be developments in terms of new antivirals, better vaccines, longer acting vaccines. All of that's going to be important to learn, and also understanding the seasonality, because it hasn't quite settled into a seasonal virus like other coronaviruses have.
And in regards to long COVID, I know there's been a tremendous amount of research. The way in which long COVID manifests, it just seems like there's a wide array of symptoms. So, what can you tell us about what we're learning about long COVID?
We're learning that maybe about 5 to 10% of people who get infected, for some reason, don't completely get back to their baseline even 3 months later. We kind of have some ideas of what the risk factors are. We think that this has to do with their immune system. Certain arms of the immune system are overactive in people with long COVID, but we know that long COVID is sort of an umbrella term. So there's lots of things that are getting grouped under there, and it's going to take some time to really kind of siphon things through and see exactly what's long COVID, what's something else. And that's going to be something that's frustrating to patients. But I think that's the path forward, is scientific research, basic scientific research to unravel the mysteries of long COVID. But I think we're starting to get some information that there actually is an immune system abnormality in this group of people.
4 years ago, we had no idea how quickly our lives were going to change for a good solid 2 years. But particularly in healthcare, it was a major shift. How has your life changed as a doctor since COVID?
I was somebody that was working on pandemic preparedness, emerging infectious disease. So this is something I was kind of preparing for, thinking about how it would happen. But it's obviously a very different thing when you're in the midst of it. At the same time, dealing with the policy issues that were going on with COVID-19 one day and the next day in the hospital taking care of patients. So I think the biggest lesson to me was how unprepared hospital systems were, how little capacity they had, and how it became very difficult to choose what you're going to do. So, for example, many hospitals stopped what are called elective procedures. And elective doesn't mean cosmetic surgery. It means you've got some flexibility and timing, but not infinite flexibility. And how do you balance that? Many hospitals were dealing with massive financial problems prior to the pandemic, and then the pandemic kind of pushed them over the edge. So we've got a crisis now in rural health. It's just become something that really focused in on the problems in U.S. health, in the healthcare system, and how unsustainable aspects of it are. And the thing is, we're probably not much better now today. If a new pandemic hit hospitals, they would still be under surge crisis conditions with staffing problems, and I think that's something we have to know going forward. That we have to be proactive.
Looks like the whole industry is suffering from long COVID to a certain degree. COVID hasn't gone away. Doctor, thank you so much.
Thanks.